Here we'll talk about drug addiction. It is a state of periodic or chronic intoxication which is detrimental to the individual and the society, produced by repeated intake of habit-forming drugs. So the three important words you have to remember in this definition of drug addiction is intoxication, detrimental, and habit-forming drugs. So it is a state of periodic intoxication which is detrimental to himself and also the society, which is produced by taking this repeated use of habit-forming drugs. Right? Intoxication, detrimental, and habit-forming drugs. Now let us see the criteria of drug addict. There are three things. One is the psychological dependence, physical dependence, and development of tolerance. Coming to the psychological dependence, there is a strong compulsion to take the drug. So if the person decides to stop taking the drug, he cannot do that because there is an overpowering compulsion to take the drug. And physical dependence, if he stops taking the drug, it will lead to withdrawal symptoms. So he physically cannot stop taking the drug. So this is a physical dependence. And development of the tolerance. So initially only the small doses of the drug will cause the effect. After repeated exposure to the drug, only the large doses will cause the effect, right? So tendency to increase the dose is a development of tolerance. So the three things in the criteria for the drug addict is psychological dependence, physical dependence, if the stoppage of drug leading to withdrawal symptoms, or if there is any strong compulsion to take the drug, and also increased doses or this development of tolerance is a criteria for the drug addict. Coming to the management, first we have to identify such persons and we have to motivate them for this detoxification. So once we motivate them to stop using the drug, there might be requirement of hospitalization. If they are physically dependent or psychologically dependent, there are some cases which we have to hospitalize the person for this detoxification. And after this detoxification or this post-detoxification stage, we have to counsel them and follow up because there is a tendency to go back to these old patterns, right? So we have to follow them and counsel for not using the drugs, and rehabilitation is also available. So along with all of this, you have to also change in the environment, and psychotherapy is also very important steps. So in the management, first we are identifying and motivating the person to go for detoxification. So we are doing this detoxification. If it is needed, we are also hospitalizing the patient, right? So after this detoxification, we are counseling them, we are following up, and if needed, rehabilitation is also available. But along with all of this, change in environment, psychotherapy is also a very important step in managing the drug addict. Coming to the prevention. So education of this target population by radio, TV, leaflets, posters, by spreading awareness, and Narcotic Drugs Psychotherapeutic Substances Act 1985. So this act, and also by spreading awareness, we can prevent this drug addiction in the target population like adolescent age group people. The drug culture, disturbed environment, curiosity, and the natural tendency to try the drugs, and TV, movies, internet, escape from the tensions or stress, all these conditions will favor or cause the habit of drug taking, like drug addiction. So this all conditions will cause habit forming nature of drugs. So if we summarize the whole thing, the 3 points you have to remember in definition is intoxication, detrimental, and habit forming drugs. So it's a periodic intoxication which is detrimental to him and society, produced by repeated intake of habit forming drugs. Criteria, again 3 things: psychological, physical, tolerance. Coming to the management, first we have to identify, then hospitalize, that is detoxification, and post-detoxification counseling and follow-up is very important step, and rehabilitation is the last step. And along with all of this, change in environment and psychotherapy. Prevention, we have to spread the awareness, and there is also Act in 1985. So all these conditions are favoring this formation of drug forming nature of drugs. Bye.